I'm Katie Lewis. I'm a Research Associate at the National Centre for Mental Health and the Bipolar Disorder Research Network. People with bipolar disorder can experience episodes of high mood, called mania, or low mood, called depression. And it's really important that we figure out what causes these episodes because they have a profound effect on people's lives. And if we figure out what causes these episodes, then potentially we can prevent them from happening in the first place. So we know that sleep loss has long been noted as a potential trigger of both low mood and high mood, but not everybody with bipolar disorder will necessarily become manic or become depressed following sleep loss. So our aim was to find out, within people with bipolar disorder, first, what percentage of them report that sleep loss is a trigger for mood episodes, and second, which people are more likely to report that sleep loss has triggered their episodes of low or high mood. So for this second bit, we focused on looking at differences between men and women and people with bipolar disorder type 1 and type 2. Now the main difference between type 1 and type 2 bipolar disorder is that people with type 1 tend to have more severe episodes of high mood, so they often require hospitalisation, or they might have psychotic symptoms, whereas you don't get that with manic episodes in type 2 bipolar disorder. So what we did was, we looked at data from 3,140 people with bipolar disorder, and all of them had been asked whether sleep loss had ever triggered their episodes of high or low mood. So what we found was that 20% of people reported that sleep loss had triggered episodes of high mood, whereas 12% had reported that sleep loss had triggered episodes of low mood. And we found that a tendency to report that sleep loss had triggered episodes of high mood was more likely among women and people with type 1 bipolar disorder. And this effect was the same even when we controlled for other factors such as age or the number of episodes people had experienced or their illness severity. When we looked at episodes of depression, however, we found that there didn't seem to be significant differences between men and women or type 1 and type 2 bipolar disorder. Our results suggest that being female and having a diagnosis of type 1 bipolar disorder might increase the likelihood of experiencing episodes of high mood following sleep deprivation. And this should be considered in situations where people with bipolar disorder may encounter sleep deprivation, such as shift work and international travel.